லைட் இன்சைட் ஸ்டோரியின் யூடியூப் சேனலினை சப்ஸ்கிரைப் செய்வதுடன் அருகிலுள்ள பெல் பட்டனை அழுத்துவதனூடாக இதன் நிகழ்வுகள் அனைத்தினையும் பார்த்து பயனடையலாம்.
This question goes to Dr. Risi. Carbon monoxide, CO. Poisoning is a serious health hazard often reported in Western countries due to its colorless and odorless nature, making it difficult to detect actually. This type of poisoning occurs when carbon monoxide gas builds up in enclosed spaces, leading to potential fatal outcomes. In Sri Lanka, while less frequently discussed, carbon monoxide poisoning still poses a significant risk, particularly in poor ventilated homes or during the use of certain household appliances. Dr. Risi, we learn about carbon monoxide poisoning deaths in Western countries. Do we have it in Sri Lanka? Could you give us a few examples related to this carbon monoxide poisoning deaths in Sri Lanka?
Yeah, it's a very different question in this context. But Rahman, I feel this topic is a little bit, very curious to most of the people because this carbon monoxide poisoning, it's not widely explained or discussed in the common platforms due to so many various reasons. So what I feel is at this point, when you raise a question on this topic, you said its colorless and odorless nature has become a lethal nature. So you call that it's a silent killer. Carbon monoxide is a silent killer. We have heard of something called carbon dioxide, which is a byproduct of the respiration, and we have to breathe it out to make sure that it is not toxic to the body. So likewise, carbon monoxide is also something which can be inhaled inside and is a very serious health hazard due to its nature of various reasons. Okay, so I'll come to that point. Before that, I hope that I don't know whether if anybody has, our audience has such a importance for carbon monoxide. But anyway, I will have to explain this nature of carbon monoxide, which is gas, which is a byproduct of incomplete combustion. Say, like, if there is a fire somewhere, any material which contains carbon, and if there is any incomplete combustion, you get the carbon monoxide as a byproduct. Normally, it is discussed as a very minor detail, as it causes minor headache, lethargy. Say, like, I would say, when you just go into a situation where you do a lot of burning at your backyard and do a lot of other stuffs getting filled with fire. Sometimes when you stand for some time with inhaling those smoke, we get that sort of dizziness. It is mainly due to this carbon monoxide inhalation. So there is a percentage in the body that is carbon monoxide can be tolerated, but when it increases, we get into a very serious situation. So definitely, I would address something about the carbon monoxide. I think our viewers would understand why carbon monoxide is taken into the consideration, because hemoglobin, which is one of the component in the blood, which is responsible for carrying the oxygenated blood from the lungs to the tissue level to deliver for its metabolism, where carbon monoxide is one of the serious competitor of oxygen to hemoglobin. They say it's more than 200 times competitor in joining hemoglobin. We call it affinity. Affinity of carbon monoxide is 200 times. So there is something we discussed. There is a oxygen dissociation curve. So the right shift to the oxygen dissociation is better for oxygen delivery at the tissue level and give good supply. Oxygen is one of the most important gas which we inhale for living. When this carbon monoxide binds to those areas in the hemoglobin and not letting the oxygen to be carried, then it's a serious condition where you get deprived of oxygen, and the tissue body level get low oxygen levels, so which is called in the medical term hypoxia. That will cause several issues. When it comes to the heart, you can get less blood supply to the heart, where heart has to function properly to maintain the blood circulation, which is not going to be there the same as it is when the carbon monoxide is driven into the system. And also, you say there is another tendency in the brain, say the carbon monoxide poisoning can cause very minute level like headache, lethargy, and confusions, and up to even when there is a level increase more than 40%, you can go into coma as well. I think it's a very interesting condition in Sri Lanka because you see, there was a very tragic situation in Sri Lanka sometimes back in the Himalaya, a family who had slept with closed doors because their rooms were air conditioned, so they kept it closed. So some sort of a fire started coming from the kitchen. There was a leakage, it seems. So as a result of it, everybody died in that house due to later only the postmortem. We could say that it was due to the carbon monoxide poisoning, and there was serious arguments at that time. But what I say is, this is a scenario where when you are closed, because nowadays in our area we see there is a lot of AC getting insulated at several places. So in that case, we have to definitely close the environment for the outer space. So when there is such instances, when you sleep, then you see that something get caught for carbon monoxide, I mean fire, and you get to inhale that sort of air continuously, and you become paralyzed in your bed, and you feel there is something happening and you cannot even walk. So that is one of the tragic conditions in foreign countries. People die. It's not very common, but it is there. So it is one such incident that I think it's better that you raise this question at this point, because I see those days, we have windows and we used to keep open and sleep. That's how we were born and bred. But now the conditions are changing with the environment and also the climate changes. The global warming is already there. So there is a serious issue in this. So what I'm telling is, when you get into a place where, see, a rural area where they only just go with the firewoods and things there for their living, then there is a potential tendency for them to get a slow poisoning of carbon monoxide. So basically, in environmental, Ministry of Health, Ministry of Environment has brought up this concern, and they have put up a guideline in I think 2022 regarding guideline on management of indoor quality air, so air quality. So this something like that. So that is how the system is working onto it. But this is one such condition that I think we need to be aware of. When you are packed in a house and we are locked in a house and we don't have any contact with the outdoor exposure, then we have to be very vigilant and careful when locking the things and going out, because sometimes we lock the children and go out. Those sort of things are there. Okay, thank you, Rahman.
Thank you very much, Dr. Risi. I cannot some points on Dr. Risi. Monoxide is the competitor of oxygen. It affects hemoglobin level of blood, and sometimes it may cause hypoxia and danger of going on coma conditions. I think those points I can note on our doctor's answer. Dear viewers, you are watching the Elite Inside Story